it's an honor, needless to say. I am closely related to the Academy of Human Life because I was part of getting that all started. And so when it came time to having board of directors and officers, they decided it was better to get somebody younger. And so here I am still doing what I can do, thank God. And thank you, Father, for the prayer to the Holy Spirit. The Holy Spirit has to help us with this communication. Just so you know what I do fairly often, and in the last few days, an 11-year-old girl in California who was diabetic coma and then was said to be brain dead when her family members would get around her bed and pray the rosary. Her heart rate would go up and her blood pressure would go up, and then they'd stop and it would go down, and they'd do it again. And the family did all they could to keep from continuing with what they were doing about the brain death. They had already done one apnea test before we have to put it in writing to get them to stop to do the apnea test. We did everything, go to court. It was court and on weekends, so we couldn't get anybody on court. The parents did everything they could. They said, no matter what, we're going to do the second apnea test. But you know what happened? She breathed.
Wow.
She breathed. She was hypothyroid. She had TSH. It showed that her hypothalamus was functioning, but not enough to give her normal thyroid. As far as I know, they still won't give her thyroid. These patients get hypothyroidism. They get swelling of the brain from hypothyroidism, and then they won't give them thyroid unless they're going to be an organ donor. Then they give it to them to get the organs in better shape before they take the organs. How did I start all this at Cardinal Glennon Hospital, Dr. Burke? Joseph, 1975, wouldn't move, wouldn't breathe. EEG was done. It was reported as consistent with cerebral death. Suggested to stop treating him, but I continued to treat him, and there he was when he was 7 years old. He went to school, got good grades. Eventually, he married, his 3 children. Some of the things that are very important about all of this is to look at the various aspects of this issue about life and death, and sometimes what happens is that we don't discipline our minds. We don't have to in ordinary life, except times when it really counts. But we have to do it in this aspect of life and death. First of all, there's a philosophical approach, and it has to do with the concept of life and death. And death has to be when no longer alive. There's no soul-body unity. And people think about that, and then they go on about, well, I can't see the soul, and I can't see the soul leave, and all of that kind of stuff. But it has to be behind, well, what's going on. But the law, the legal thing has to do with the statute. And I would say that there should be a universal standard, should be, so far as that's concerned. We have the UDDA in the United States. It's not universal, but death is the same, no matter what your state in the United States or whatever your country's in. So the legal aspect of death ought to be a universal standard. General criteria ought to be there. And then someone is not dead unless there is destruction. The destruction is manifest by autolysis. Autolysis, the word autolysis, auto means self, that kind of thing. Lysis, destruction, rupture. Actually, the word was applied as far as I can tell, originally when the enzymes that are released when life leaves are self-destructive, and they keep on to destroy cells. And once death occurs, beginning with autolysis and continuum, there's destruction manifests later as decomposition and decay. So far as death is concerned, no one should be declared dead unless the three vital systems, the cardiac circulatory system, the respiratory system, and the nervous system, it ought to be a system, but in the world in which we live, we have to talk about the brain. So that ought to be in the law at a minimum. The medical aspects are specific medical criteria that confirm the legal standard has been fulfilled. And then there are tests that are done. The fourth thing is tests. The tests confirm that the specific medical criteria, the tests confirm the specific medical criteria, see this medical, are in accord with the statute and do not contradict the concept of change from living to dead. That is, the soul-body unity is no longer. St. Augustine taught in City of God, chapter 11, between alive and dead, there is no room left for a third state, in which a man is dying or in death. For if alive, that is before death. If he has ceased to live, it is after death. It is clear then it is never dying or in death. So I try not to use the word dying, since I know more about this. I use it appears, or it seems to be, that death will occur soon. And of course, many of us have been around for a while and know that there are exceptions when somebody is said to be dying, but when somebody is dying, they're still living. Joseph, the patient that I show you, and every living person has life. Each person is one specific, unique person with the soul-body unity. And then during life, there's interdependence of cells, tissues, organs, and systems. No single organ, not even the brain, is the integrator of the body. The human person, there's unity of the body and soul. And as the Catholic Catechism says, because of its spiritual soul, that the body makes the matter become a living human body. This was formally declared by the Council of Vienne in 13. Incidentally, I don't, because of all of you, I don't see that end of the slide, but it's okay. I gave a radio presentation in Terre Haute, Indiana, and one day, and as I was at the end of that radio presentation, a lady came to the door and gave me a brochure that had on it, "The life of the body is the soul. The life of the soul is God." Now, life on earth is somewhat like a line that you can draw. It has a beginning. The beginning is creation. And that's very, very important, that the beginning of the person is created. God creates from nothing. The procreation that goes between the love of the husband and wife and God. And there was a time when there is a time when the person begins, and that's creation, and that's when time for that person begins at that time. Conception is another word that we can use. It's a very important word, but at conception, we can know that a new human person has begun. Life on earth is a continuum, has its ups and downs. Important events in life: birth is an important event, change residence from their own private intrauterine seed, made by the baby, by the way, and also taken away by the baby. and then the baby is born, and then we live on earth, ups and downs, very important event, getting married, graduating from college. Eventually, life on earth ends, and that's death. Death is an event that marks the end of life. It's also a word that is used to describe what has already occurred. To be dead, it's the dead body. It's the remains of someone. But there's a change of state from alive to dead, and there is a time when that occurs, and that's called death. Now, preservation follows creation, and I use that words because that's what's in the Sister Agrita, the miracle of the miracle of God. I think that's the title of it. But I've been saying this for a long time, and then when I read what Mary told Sister Agrita, it's the same words. And preservation is very, very important. It's rooted like the word conservative. Keep in mind that a conservative is conserving, preserving what God has created. In contrast, by the way, the liberal is following the desires of man. But in any event, let's get back to this. Circulation of the blood is necessary. The heart is just a fascinating organism. The heart is just a fascinating organ because it beats on its own. It doesn't need the brain to beat. It's just amazing. It has its own nervous system where the impulse starts, and with tiny little fibrils to every muscle of the heart, there's nervous system, makes the heart beat, makes the heart contract, and it stops it too. It's just fascinating. Respiration is oxygen in and carbon dioxide out. It's important to realize that's what that word means. We need that. We need water. We need food, proper temperature of the body and environment, and exits for stool and urine. Death, at death, the soul body unit is no longer. The living person is changed to the dead remains. A dead body without life, a corpse, a cadaver. Autolysis begins. Someone is either alive or dead. There's no in between. Death has to do with destruction, disintegration, dissolution. Death ought not to be declared unless the respiratory and circulatory systems and the entire brain have been destroyed. It's worded not unless, and not unless to protect living persons. If the systems are functioning or have capacity to function because not destroyed, the person ought not to be treated as dead. What treated as dead means burial, embalming, cremation, and then organ removal, and that's what's drawn the attention to this issue. In brain death or neurological criteria, to simplify it as much as possible, no response to painful stimulus, no response to some brainstem reflexes. By the way, they test maybe 5, maybe 6 brainstem reflexes when there are 14 brainstem reflexes. The apnea test is a test that has nothing to do with sleep apnea. It's important to know that. The apnea test is done on a patient who is in an intensive care unit on a ventilator. Their color is normal, their blood pressure is normal, their heart rate's normal. They digest food, they put out urine, and somebody takes away their life-supporting ventilator, not just for a little bit, for up to 10 minutes. And they skip the breath during that time. If we breathe 20 times a minute, then the ventilator's 20 times a minute. You take away the breath for 1 minute, it's 20 cycles. For 10 minutes, it's 200 cycles 200 breaths that they take away during the apnea test. And that's what they did already to that 11-year-old girl I told you about. They already did it. They already made her get that way. I don't have any tests because they won't give us tests. I don't have any results of the test, but they made her very likely get acidotic, and it didn't help her. And then they attempted to do it again. But in between, we educated the family not to do an apnea test. No one should get an apnea test. The EEG brainwave test, a lot of people think brain death is flat brainwaves. It's not required. It really clearly has not been required from the very beginning, but certainly by 1971, the Minnesota criteria was published. Said no longer do we have to look at it. Look at the EEG. Even destruction of the brain is not required in this declaration of brain death. In brain death, the patient's on a ventilator. The ventilator only delivers air with oxygen to the lungs. It's a mechanical part of it. That's all it does. The rest of respiration is gas exchange, oxygen in, carbon dioxide out, physiological, has to do with life. The ventilator moves the air in. An analogy can be gasoline is put into the car, but it does not make the engine go. The ventilator, by the way, does not mask death. The ventilator delivers air into the lungs. The ventilator does not do respiration or circulation. Sometimes the machine is actually a ventilator. Sometimes they call it a respirator, but it's not a respirator. Respiration is the exchange of oxygen and carbon dioxide, and the ventilator only delivers air. That's all it does. And then absorption of oxygen via circulation to all the tissues of the body, where metabolism is done. Respiration is done by the living person. The ventilator does not work on the cadaver. The beating of the heart is intrinsic to the heart. The ventilator supports oxygen going into the body, but it does not make the heart beat. Apnea test, ventilator is disconnected for up to 10 minutes. The patient must prove that he or she can take in a breath without a ventilator or is labeled brain dead. Then it's legal to stop the beating heart, cut out the heart and other vital organs. Everybody must learn no, no, no to the apnea test. When declared brain dead, that means not dead, the patient has a beating heart, circulation, digests food, makes urine. There's internal control of temperature. Wounds heal. They fight infection. They get fever. And the heart rate and the blood pressure increase when they cut into them to take the organs. At Johns Hopkins University, in 10 patients that they studied, in all 10 of them, the heart rate and blood pressure went up. So they don't do any more tests, then they'd have enough. The brain death or neurological criteria is preferred now. Consider that all of these things here are not relevant to being alive. That not relevant is important because 1981, the President's Commission outlined the clinical findings and separated out those that are relevant and those that are not relevant to being alive. Incidentally, none of these things happen in a cadaver. Brain death is not death. Now, when treatment is continued, a person can live for a long time. How long? Joseph, I told you about. And then TK. TK was my patient, by the way. It's reported in the literature as the longest survivor. TK was a 4-year-old boy, had meningitis. When about 2 weeks after he was declared brain dead, the nurse called and said TK's blood pressure was going down. So I went over to the hospital and I said to his mother, I said, TK, but of course I didn't call him TK. And I know his mother's name. I see no reason why I can't tell you, but since they do TK, I'll stick to that for right now. But I said to her, I said, TK's blood pressure is going down. Do you want me to do anything? And she looked up at me and said, well, what can you do? I said, well, sometimes we can medication, and then sometimes it'll respond and the blood pressure will respond to that. And she looked up at me and said, get on with it. I'll never forget. I gave him medicine for blood pressure. He was not a very long time, and he lived 20 years after the declaration of brain death. The autopsy is reported showing that he essentially had a calcified brain at that time. Jahi McMath, the 13-year-old girl who was declared brain dead, her mother got on the TV and said, will somebody help? And my son was next to me and said, Dad, what are you going to do? So I got on a plane and went to California. They wouldn't let any doctors in. The way I got in is I got in at 2 o'clock in the morning. Her stepfather saw me and says, come on in, Pastor, come in. So that's how I got in. We were able to get her treatment started when she was in California. She had no nutrition for 30 days without nutrition. But anyway, we got her out of California and transferred to New Jersey. In California, she had a death certificate. In New Jersey, because the law is different, they could treat her as being alive, and they did, and she lived more than 4 years. And when she died of something other than her problem with her brain. Alan, 7, I said here, but it's really 8 years now. He almost drowned in Montana. We went to Montana, helped to get treatment started for him. He lives at home with his mother and father and brothers and sisters. Zach Dunlap, you hear a lot about. 20-year-old young man, 4-wheel accident, was declared brain dead, and then had a cousin who was a nurse and continued to stimulate him and got a response. And then he had to convince the doctors that it was a response from Zach, that he was alive. Stopped the transplant procedure. The helicopter was landing. They stopped that. And Zach, I talked to him a few days ago, and he's doing well. He's a supervisor of a construction crew, and he's doing very well. And so, but what do these patients have? They all have a relative or someone who speaks up to protect the life of the person. One of the things that I do early on is get them not to do another apnea test if they do it, and everyone must learn no to the apnea test. Now, the law in the United States, the Determination of Death Act, says this. First of all, it's an individual who has sustained either, and we only die once, only once, but here they have 2 ways. So it's either 1 or 2. 1, irreversible cessation of circulatory and respiratory functions, or 2, irreversible cessation of all functions of the entire brain, including the brainstem, is dead. And then just to finish the reading it, a determination of death must be made in accordance with accepted medical standards. First of all, you have to see that both of them have irreversible, both of them have functions. Irreversible is one of those words that you can really only understand it by the opposite, the reversible kind of thing. And in medicine, especially from a person who has practiced medicine for a number of years, there were multiple things that were irreversible at one time that are now reversible. It's one of those words that gets used in a strong way or not so strong way. Does it belong in the law? I don't think so, but it's there. And then cessation of circulatory and respiratory functions, even that in itself, if those cease, that's not death. When somebody stops breathing, their heart stops. That doesn't mean they're dead, and obviously it's a serious problem. but it takes more than that to declare them dead. But this is what they use for the declaration of that. But this was secondary to the development of brain death. Secondary in the sense that the second part is why they developed all these laws, and the laws went. The beginning one was the American Bar Association definition of death. It used just the single term function. Then the Uniform Brain Death Act, and it used functioning, and those laws were discarded to get up here to the Uniform Determination of Death Act. But it's very important to know that all of this is developed around brain death. And then what they were stuck with is the only way they could declare somebody dead is if they could get a neurologist or go to a hospital of some kind. And they said, well, we have to have a different way to declare them dead. So they put this part in. And of course, this part now is used also to get organs. How about this? Irreversible cessation of all functions of the entire brain, including the brainstem, is dead. Again, absence of function, it doesn't even mean that the brain is destroyed. Irreversible is there. And then must be made in accordance with accepted medical standards. What's being pushed now are guidelines from the Academy of Neurology. Guidelines are guidelines. And that is just one of the criteria for death. Between 1968 and 78, there were 30 disparate sets of criteria, all of which were someone could be declared dead by one, but would not be dead by the other. Here's what I think that you should do is there should be, to declare dead, no respiration, no heartbeat, and no circulation. And that has to be due to destruction of organs and tissues of at least the three vital systems. The recommended statute should be written in the negative. No one shall be declared dead unless the respiratory and circulatory systems and the entire brain have been destroyed. Such destruction shall be determined in accord with universally accepted standards. This is solidly based medically and ethically. We give out cards. Here at lifeguardianfoundation.org, you can get these cards. You can make one yourself. It's very important that you carry something with you, and it begins with I direct all medical treatments and care, including nutrition and hydration. Why is that so important? Because you want to be treated. And if you go in the hospital and you're unconscious and on a ventilator, you have to be treated when you go to the hospital, and so often it will go in a different direction. And no matter how it's given, you need food and water. It's given to protect and preserve your life. Do not hasten death. Do not do an apnea test. Got that? Do not do an apnea test, and do not take any organ for transplantation or other purpose. It gets transplantation therapy. Research or education is how the permission for taking organs. It's all put into together: transplantation, therapy, research, and education. So when if someone says yes to organ transplantation, death, yes to brain death, whatever it is, they get all of that together. In conclusion, then, the soul is the life of the body. To be dead, it's a body without soul. No one ought to be declared dead unless the respiratory and circulatory and nervous system have been destroyed. When declared brain dead, the taking of organs now begins with the beating heart and circulation. And the question is, do you really want to be an organ donor? So with that, I'll stop and see if any of you have any comments or questions. And